Welcome to Lesson 14. In this lesson, we will cover ICD-10-CM Chapter 12, which includes diseases of the skin and subcutaneous tissue, coded from L00 to L99. This lesson is for educational purposes only. Please refer to official ICD-10-CM guidelines. Lesson objectives. In this lesson, you will learn how to code pressure ulcers using category L89. The difference between unstageable and unspecified ulcers. How to code healed versus healing ulcers. Rules for ulcer progression during admission. Coding for pressure-induced deep tissue injury. Coding non-pressure chronic ulcers. Chapter 12 Exam Importance. Chapter 12 is commonly tested in inpatient CPC scenarios. Most exam errors occur due to incorrect ulcer staging, ignoring progression rules, coding ulcers that are already healed. Remember, one wrong stage means the entire question is wrong. Pressure ulcer overview. Pressure ulcers are coded to category L89. Each code identifies the site of the ulcer, the stage of the ulcer. If a patient has multiple pressure ulcers, you must assign as many L89 codes as necessary. Pressure ulcer stages. ICD-10-CM classifies pressure ulcers into Stage 1, Stage 2, Stage 3, Stage 4, unstageable, deep tissue pressure injury, unspecified stage. As the stage number increases, the severity also increases. Unstageable pressure ulcers. Assign unstageable pressure ulcer codes when the stage cannot be clinically determined, the ulcer is covered by eschar, or the ulcer has been treated with a skin or muscle graft. These situations prevent accurate staging. Unstageable versus unspecified. It is very important to distinguish between these two. Unstageable means the stage cannot be determined clinically. Unspecified stage means the stage is not documented. Never confuse these codes. Always follow the provider's documentation. Debridement and stage revealed. If an ulcer is initially unstageable and debridement is performed and the true stage becomes visible, you must assign only the code for the stage revealed. Do not continue to code the ulcer as unstageable. Documented pressure ulcer stage. Pressure ulcer staging is based on provider documented stage, OR. Accepted clinical terminology found in the alphabetic index. If the documentation is unclear or incomplete, you should query the provider. Pressure ulcers documented as healed. If the provider documents that a pressure ulcer is completely healed at the time of admission, then right arrow do not assign any pressure ulcer code. This is a very common CPC exam trap. Pressure ulcers documented as healing. If a pressure ulcer is described as healing, assign a code based on the documented stage. If the stage is not documented, assign unspecified stage. If it is unclear whether the ulcer is new or healing, you must query the provider. Healed at discharge. If a pressure ulcer was present on admission and healed during the hospital stay, you must assign the code for the site and stage at the time of admission. Do not omit the code. Pressure ulcer progression. If a patient is admitted with a pressure ulcer at one stage and the ulcer progresses to a higher stage, you must assign two codes. The stage at admission, the highest stage documented during the stay. This rule is frequently tested. Deep tissue pressure injury. For pressure-induced deep tissue damage, assign L89-6. Only one code is assigned. Do not assign additional stage codes. Non-pressure chronic ulcers overview. Non-pressure chronic ulcers are not caused by pressure and are coded separately from pressure ulcers. They are often related to vascular conditions, other underlying diseases. Non-pressure ulcers documented as healed. If a non-pressure ulcer is completely healed at the time of admission, right arrow do not assign any ulcer code. The rule is the same as pressure ulcers. Non-pressure ulcers documented as healing. If a non-pressure ulcer is described as healing, assign a code based on documented severity. If severity is not documented, assign unspecified severity. If unclear right pointing arrow, query the provider. Healed at discharge, non-pressure, if a non-pressure ulcer was present on admission, and healed by discharge. You must assign the code for the site and severity at admission. Non-pressure ulcer progression. If a non-pressure ulcer is admitted at one severity level and progresses to a higher severity, assign 2 codes. Severity at admission. Highest severity during the stay. Documentation rule reminder. For all ulcers, use provider documentation. Use accepted clinical terms. If documentation is unclear, right pointing arrow, query the provider. Correct documentation is the foundation of correct coding. Chapter 12 Common Exam Traps. Common mistakes include confusing unstageable with unspecified, coding ulcers that are healed, missing progression rules, assigning only 1 code instead of 2, forgetting deep tissue injury rules. Quick exam recall. Remember, L89 codes equals site plus stage. Unstageable does not equal unspecified. Healed at admission, right pointing arrow, no code. Healing ulcers are still coded. Progression requires 2 codes. Deep tissue injury, right pointing arrow, L89, -6 only. Lesson 14 Summary. In Lesson 14, we covered pressure ulcer staging, unstageable versus unspecified ulcers, healing versus healed ulcers, ulcer progression rules, non-pressure chronic ulcer coding,